Hello everyone, I'm Dr. Chan. Today I would like to share a little bit of information regarding pigmentation, which is the coloring of a person's skin. When you're healthy, your skin will look normal. But if you're ill or injured, your skin may change color, becoming darker, which is called as hyperpigmentation, or lighter, called as hypopigmentation. So when our skin tone looks uneven with patches of hypo or hyperpigmentation, one may feel that it affects their level of confidence, and hence they try to cover up with some amount of makeup. Long term of covering up with makeup and without its proper removal, in fact it can cause further problems and blemishes. So how does hyperpigmentation occur? Hyperpigmentation occurs due to irregular build-up of melanin in the keratinocytes, causing darkened spots or patches on the skin. The melanocytes, which are found in the stratum basale of the epidermis, it produces melanin, which are transported by the melanosomes to be deposited into the keratinocytes. When the skin is exposed to UV rays from the sun or tanning salon, it will trigger the keratinocytes to release chemicals that stimulates the melanocytes to produce more melanin. Consequently, it causes darkening of the skin due to accumulation of melanin in the keratinocytes. The increased melanin production actually protects the epidermal cell DNA from damaging effect of the UV rays and breakdown of the folic acid. If there is too much of sun exposure, it will increase the risk of destroying cell structures of the skin. When there is sufficient damage to the cell's DNA, it may lead to skin cancer. So the common types of hyperpigmentation are such as solar lentigo, which is more predisposed in aging skin, especially areas which are exposed to the sun UV light. So other than that, there are also freckles. Freckles appears to be smaller in size, where its borders are very well defined. Also appears at areas which are exposed to the sun. It can be early onset, means that it can appear during childhood or even during the adolescent years. Next is the melasma. Classically, melasma appears as big brown patch with irregular border, commonly found at symmetrical areas on the face. It is more common among females who are above 40 years of age, lesser found in men. Premenopause or menopausal women or on hormonal therapy increase their risk for getting the melasma. It is important to prevent hyperpigmentation from worsening by focusing more on hydration and sunscreen. Reduce UV rays exposure and avoid harsh irritant containing products. Avoid using topicals or treatments that will further cause inflammation, irritation, or damage to your skin barrier. There are several methods to reduce skin darkening significantly, ranging from topical to energy-based devices. Depending on skin types and conditions, certain treatments may not be suitable or may cause adverse reactions or worsening of the existing hyperpigmented areas. So I would recommend seeking professional advice before self-treating your dark spots to prevent worsening it. Seeking advice and treatment earlier can prevent from complication and reduce the number of sessions needed to recover.